Warm welcome to all attendees to this session on ensuring fair recruitment for migrant care workers, one of the sectoral sessions of the Global Forum for Responsible Recruitment. Our objective for this session is to explore recruitment issues that are specific to the circumstances of migrant care workers with a focus on women workers. Care work, we know, is often referred to as the work that makes all other work possible. Care work comprises a broad range of occupations, including nurses, teachers, doctors, early childhood educators, as well as home cleaners and personal care workers. And most care workers are women, frequently migrants, and working in the informal economy under poor conditions and for low pay. Migrant care workers face their own specific and particular challenges. They may experience discrimination and unequal treatment in recruitment and employment conditions. And this session will focus very much on these workers. The concerns of care workers has come into the spotlight recently with the advent of the pandemic. And while care workers have been the mainstay of the response to the pandemic, some care workers have been excluded from the most basic rights and protections, such as social security, sick leave, occupational health and safety, including access to personal protective equipment. And indeed from emergency or compensatory measures, such as income loss support. And this takes place in a broader context of concern, the growing care crisis, which affects countries all over the world. By 2030, the number of people needing care is expected to reach 2.3 billion, driven by an additional 200 million older persons and children. But the indecent working conditions that mark the sector increasingly make it unattractive to workers, with workers leaving the sector in significant numbers, and with employers in the sector finding it more and more difficult to recruit workers. If not addressed properly, current deficits in care work and its quality will create a severe and unsustainable global care crisis, stifling development and further increasing gender inequalities in the world of work. The challenges are vast, and we're here today to learn about some of the emerging practices and solutions. And let me start by giving you a broader introduction to the session and an overview of our very distinguished speakers. And before I do that, perhaps a little housekeeping. During this session, we have interpretation available in English and Spanish, and we'll start the session with a round of introductions, moving to an intervention from each panelist. I'll ask the panelists each 2 questions, and I'll kindly ask them to keep their responses to between 3 and 4 minutes for each session. So without further, it's my pleasure to introduce our distinguished panelists, starting with Mr. Stefan Heuker. Stefan is a director with 15 years experience and currently deputy head of international affairs at headquarters of the German Federal Employment Agency in Nuremberg. He's been working, among other assignments, as head of corporate strategy, finance, and HR planning divisions. And before joining the headquarters, he was head of a local employment agency in Hamburg and member of the management board of a state employment agency. He has a university degree in business administration from Kiel University. The BA facilitates entry to the labor market for migrant workers, including nurses and care workers from a number of countries, including Mexico, the Philippines, Tunisia, and Eastern Europe. So Stefan, you have really a bird's eye view of the recruitment of migrant care workers. Also very pleased to welcome Donaciano Dominguez Espinosa. He's the Sub-Coordinator General of the National Employment Service in Mexico. Mr. Espinosa is currently the Deputy General Director of the National Employment Service and is responsible for coordinating the tasks related to labor mobility to facilitate the job placement of those seeking work in Mexico or in other countries. He has more than 20 years experience in public administration, always working on issues related to active labor market policies. Donaciano will talk with us about how the Mexican Public Employment Services promotes labor mobility policies, and specifically their experience of labor mobility of nurses between Mexico and Germany, an experience they are opening up to other countries too. And then moving to Kate Telenko. Kate is from the Corvus Health. I hope I've got that right. She's from Corvus Health. And she's a founder and CEO of Corvus Health. It's the global health workforce services from which firm which resolves health workforce challenges through a novel set of approaches, including team redesign, workflow retention, workflow optimization, increasing staff retention and reducing staff burnout, very important topics, particularly in the care sector. The company also is involved in training, HR management, productivity and quality improvement, recruitment and advisory services. Dr. Tulenko is a globally recognized expert in health workforce and health systems strengthening and has served on expert panels for the WHO, the American Hospital Association, and the Aspen Institute. And previously, Dr. Tulenko served as director for Capacity Plus, the US Agency for International Development's flagship Global Health Workforce Project, as Vice President, Health Systems Innovation for IntraHealth International, which is a global nonprofit health systems contractor, and as coordinator of the World Bank's Health Workforce Program. Corvus Health has become one of the finalists of the IOE Migration Challenge Startup Competition 2021. So congratulations to you for that. And then next, I'd like to introduce Mrs. Genevieve Genciano, who is the Migration Program Coordinator of Public Services International, a global union federation representing workers in the public sector. Genevieve has an extensive background on international migration, development and human rights issues, and based on her 25 years of policy and project experience in various countries. Her work involves building the capacity of PSI's unions in national, regional, and global policy advocacy, and coordinating PSI's union development projects on migration, refugees, and internally displaced persons in Africa, Middle East, and North Africa, MENA countries. PSI calls on all governments and non-state actors to uphold fair recruitment of migrant workers, and actively advocates for the protection of human and labor rights and full access to quality public services to ensure inclusion and solidarity. So let's start with a panel. I'll come to you first, Stephen Heuker. Germany has a comprehensive program for recruitment of migrant care workers, including nurses, and has signed a number of bilateral labor agreements with countries of origin to recruit migrant health workers. So can I ask you to briefly explain BA's regulatory and oversight model for the recruitment of healthcare workers? And has the pandemic affected the way in which you operate? So can I ask you to take 3 to 4 minutes to answer this first question? Thank you.
Yes, thank you. So Germany is competing with various other countries to attract skilled workers in general and care workers in particular. The German Federal Employment Service, the BA, is committed to fair migration processes, and as there is almost no regulation for private recruiters in Germany, we strive to make this commitment visible internationally through leading by example. As a public employment service, we still do recruiting ourselves in the countries of origin, and wherever we do this in cooperation with partner employment services or other partners in the countries of origin. Wherever we do that, BA adheres to the standards developed by the International Organization for Migration for ethical cross-border recruitment and placement. And we are actively involved in the ongoing development of further principles of fair migration. We lead by example. We guarantee employers and care workers a fair and transparent process based on our bilateral agreements with the respective public employment services of the partner countries. So in doing so, we follow the WHO Code of Conduct and avoid recruiting professionals from countries that already have a nursing shortage situation. We utilize the BLAs, the bilateral recruitment agreements. They ensure high quality standards in the placement process and guarantee a sustainable form of recruiting skilled workers. We do negotiate them on the basis of mutual benefits and only after conducting a thorough data-driven analysis regarding the potential of respective countries, a given surplus of skilled workers in the countries of origin, and the chances of successful professional recognition. All bilateral agreements include rule procedures and quotas to be monitored and specific regulations with regard to fair and transparent recruitment standards. A fair and transparent recruitment procedure avoids undesirable side effects such as wage dumping and indebtedness of the recruited nurses, and also exploitation, especially for female nurses. Nurses have the same rights and obligations as German nursing staff. They have the same social security coverage, and all equal rights with German staff. The binding definition of a minimum salary and training allowances in the contracts ensure that professionals recruited are paid fairly and are on equal footing with their German colleagues. These conditions are closely monitored by our own specialized staff in the visa approval department in our organization, the BA. We support the employer pays principle. Employers in our BLAs bear the costs of language qualification in the countries of origin, flat rate payment for living expenses during language training, the cost of professional recognition, either in the home countries or after traveling to Germany, the travel expenses to Germany, and so on. The costs to employers can so run into 5 digits in euros. However, employment contracts must not contain any repayment clauses. In return, employers gain linguistically and professionally well-prepared care workers. Supporting the employer pays principle represents an important step in achieving the UN's Sustainable Development Goal of decent work for all. In addition to meeting ethical standards, this can represent a competitive advantage for Germany in the international labor market. So we emphatically promote the standards, even though the employer pays principle was never legally enforced in Germany. Sadly, the related ILO and IOM standards were never included in German regulation. Our focus is on supporting care workers and employers throughout the entire migration process, from visa application in the country of origin to integration support after traveling to Germany. We do provide employers with comprehensive advice on the integration of nursing and care professionals and apprentices to ensure that the recruitment of skilled workers from third countries is sustainable and successful in the long term. Last but not least, Corona and travel restrictions. Even though the consequences of the COVID-19 pandemic were felt in all areas of labor migration, the recent signing of the bilateral agreements with Indonesia in July 2021 and Mexico December 2021 for care workers set an important course for current and future labor migration. The influx of skilled workers has resumed. Many more are in training measures in their home countries preparing to move to Germany. They are most welcome. Thank you.
Thank you very much, Stefan. And my next question to you is, how does the BA cooperate with countries of origin to ensure fair recruitment of care workers, including recognition of qualifications and non-payment of recruitment fees and related costs? I think you touched on those already in your original intervention, but if you'd like to expand a little more on that, now's your opportunity.
Yes, I'm going to do that, and we'll dig a bit deeper into what we call the gold standard of fair migration by public employment services. This is the famous triple win scheme. We are very proud of having set this gold standard. The BA and the Deutsche Gesellschaft für internationale Zusammenarbeit, the GITS, collaborate in the Triple Win program and have gathered many years of expertise. Triple Win operates on the basis of bilateral agreements between the German Federal Employment Agency and the public employment services in the respective country of origin, for example, actually Mexico. Triple Win has been running since 2013. Triple Win and other BLAs are weighing in the situation of the countries of origin, as well as the WHO Code of Conduct. The BLA might, but not necessarily must, include regulations for the activities of private recruiters, which is very important, and for self-recruiting employers as well, depending on the regulatory framework of our partner countries. Triple Win stands for a threefold gain for all parties involved: employers, countries of origin, and of course the care workers. It relieves the German job market and helps out employers desperately seeking skilled workers. At the same time, it ensures that the recruitment of skilled workers and apprentices does not lead to a brain drain in the countries of origin. Countries of origin also benefit from regular labor migration because it works as a substitute for illegal or irregular migration. For the countries facing a surplus of qualified nurses, it alleviates the pressure on the home labor market. Countries of origin will also benefit from migrant remittances as an important external source of income, as well as from knowledge transfer. Skilled nurses will get the prospect of a good job, permanent residence, and possibly even citizenship in Germany, and equality in the workplace, equal rights, payment, and duty, as I mentioned out before. Hence, the migrant workers, as a rule, are highly motivated and show considerable commitment in order to be able to take up a job in Germany. In December 2021, we had been able to conclude a bilateral agreement with the colleagues of the National Employment Service of Mexico under the new Skilled Immigration Act, by which applicants can benefit from a simplified entry process to Germany. Together with our local partners, we recruit the nursing professionals in their home regions, conduct interviews together with German employers, often on site of medical schools and universities, and prepare the chosen candidates for the professional recognition in Germany. During the language courses in the home country, the participants receive intensive support to have the basic eligibility of foreign professional qualifications for recognition in Germany clarified in advance. After entering Germany, the nurses are initially employed as nursing assistants, while at the same time they receive the necessary additional training with the aim of achieving full recognition of their foreign professional qualification. They already hold at that time a firm job guarantee as a skilled care worker after obtaining full recognition of qualification. Finally, if I might, let's talk about money. The gross monthly wage for a nurse in Germany is a minimum 2,300 before and 2,800 euros after professional recognition. Wages of 3,500 euros and more are within reach, so the whole package is quite attractive. All costs of recruitment, training, relocation, and recognition, and all related costs have to be covered by the employer, which is a binding condition for the employers to join the program. And I think that sums it up. Back to you.
Thank you so much, Stephen. And we've heard a lot about the collaboration, indeed, between Germany and Mexico. So I'll move on next to Donaciano Dominguez Espinosa. We've heard, indeed, the interesting experience and perspective of the German Public Employment Service on the recruitment of migrant workers for the health sector. Mexico has bilateral agreements with countries of destination, including Germany, as we've heard, and it seeks to ensure fair recruitment processes and the protection of migrants in the care sector. And of course, there's a very strong gender dimension to all of this. So can I ask you, first of all, what is the role of the Mexican Public Employment Service regarding the regulation and supervision of recruitment processes? And how is collaboration with a country of destination ensured to guarantee the protection of migrant workers?
Muchas gracias. Muy buenos días a todos. Un placer acompañarlos en este panel y comentarles antes que nada que el Servicio Público de Empleo en México es parte del Ministerio de Trabajo en general. Como servicio público tenemos encomendada la tarea de facilitar la intermediación laboral, entonces la vinculación entre buscadores de empleo y empleadores. Pero en el Ministerio de Trabajo hay un área dedicada a las tareas de inspección y de garantizar que los trabajadores cuentan con las prestaciones, con la seguridad social que requiere en todo puesto de trabajo. En ese sentido, y coincidiendo totalmente con la introducción que hacía Chidi de inicio, ¿no? Hemos visto con grave preocupación que en este periodo de pandemia la migración informal creció de manera desmesurada, ¿no? La creciente demanda de empleadores en países de destino, hablamos para nosotros Estados Unidos, Canadá y ahora también Alemania, creció en la expectativa de un mexicano buscar un empleo fuera de México y de migrar simplemente bajo el enfoque de una visa de trabajador de turista para poderse insertar en un mercado laboral. Eso nos hace que como Estado estemos lejos de conocer quién está viajando, a dónde está viajando y en qué condiciones está contratado. En ese sentido, justamente en la tarea que tenemos de asegurar que las empresas garanticen la protección de derechos humanos y laborales de los trabajadores, es que hemos visto con gran satisfacción esta relación que hemos fortalecido con la Agencia Federal de Empleo en Alemania, ¿no? Saludo, Estefan, mucho gusto conocerte por acá, que ha proliferado y ha sido muy fructífera de 2017 a la fecha, porque estamos convencidos que el modelo de migración laboral más idóneo es el que surge a partir de necesidades de mercados complementarios. ¿Qué tenemos en México, donde tenemos excedente de personal y qué requieren países donde garantizan condiciones laborales justas, condiciones laborales dignas, procesos de reclutamiento ético, estándares de aplicación muy idóneos para garantizar este proceso de reclutamiento ético que tanto nos hace falta, ¿no? En el caso del proceso que tenemos con Alemania, el poder hermanar un acuerdo que recién firmamos en 2021 para garantizar un reclutamiento en México y asegurar que los trabajadores viajen a Alemania, nos da la tranquilidad porque sabemos que en Alemania hay una autoridad que garantiza la protección de sus derechos humanos y laborales. Y saber que en México hay una autoridad que está asegurando quién viaja, quién puede regresar, pero sobre todo que nos permite monitorear el proceso de reclutamiento, nos permite estar cerca del proceso de entrevistas, que creemos que realmente que en el proceso de entrevistas es donde mayores niveles de discriminación se generan, ¿no? A veces por condiciones de las personas, a veces por la condición de género, con la condición física, pero permite monitorear el proceso de entrevistas, el proceso de selección, en el caso de Alemania también acompañar este proceso de desarrollo de habilidades para el alemán en México, y nos aseguramos quién concluye y después quién estará viajando ya con un proceso de homologación de títulos en México para que llegue como asistente de enfermería y en un momento dado pueda desempeñarse después como enfermera. Nos permite también el garantizar la protección con nuestras autoridades consulares en Alemania para garantizar que los trabajadores que han migrado de México están debidamente cuidados, debidamente protegidos y que los términos del contrato, que ese es un tema bien importante, que los términos del contrato que han sido validados por dos autoridades que hermanan este proceso se están respetando en el país de origen. Y aquí hablamos de la parte bonita de lo que tiene que ser una migración laboral, legal, ordenada y segura. Pero hay un factor que siempre aparece, que son los reclutadores privados. Cuando hablamos de reclutadores privados, que en México hoy están reclutando personal para otros países, nos enfrentamos a la obligación de estas agencias que están en México de registrarse ante la Secretaría del Trabajo, ante el Servicio Nacional de Empleo, para legitimar su acción de enviar trabajadores al extranjero, para garantizar que cumplen con procesos de reclutamiento ético. Sin embargo, aun cuando aquí México hace ese proceso, de pronto no sabemos cuál es la condición de la agencia en Alemania, no sabemos cuál es la condición de la agencia en Canadá, y tenemos que confiar de alguna manera en la buena voluntad de la agencia, en que nos presentan una documentación que apunta todo el proceso, pero hay un momento dado donde perdemos este acompañamiento, que es el estar cerca del proceso de reclutamiento, selección, envío y monitoreo de los trabajadores, ¿no? Entonces, insistir, creo que es fundamental para México el que los acuerdos puedan darse de manera binacional, no para que los servicios públicos asuman el proceso completo. Creo que hay un componente que dice por ahí en el tema del reclutamiento ético, la empresa paga. Las empresas tienen posibilidades de pagar procesos de reclutamiento y como gobiernos creo que nos corresponde acompañar y asegurar que estos procesos se realicen de conformidad con las leyes que protegen a los trabajadores en ambos países. Por ahí dejaría mi comentario, Chino.
Thank you very much. And again, really interesting to hear about this collaboration between Germany and Mexico, and how it serves to protect the rights of migrant care workers. You mentioned, my follow-up question to you is going to be, fraction around the main challenges and what you saw as priorities for action. But I think you mentioned already that sometimes one of the main challenges that you're facing is in relation to being able to effectively monitor the operations of private sector entity and to guarantee that they observe indeed all the measures that have been put in place to secure and guarantee the rights of migrant workers. I can give you a minute or two if you would like to add anything to that before moving on to Dr. Kate Tulenko.
Sí, gracias. Creo que el gran reto sería que como países, origen y destino lográramos entender de manera muy puntual el ente de complementariedad de mercados laborales. Y creo que eso es posible si logramos trabajar hermanados, ministerios de trabajo con ministerios donde podemos dejar patentes las necesidades que tenemos en ambos países, ¿no? El otro tema, y esto nos lleva realmente a algo que estamos trabajando acá, que es la idea de desarrollar un observatorio laboral, ¿no? Un observatorio de inteligencia de mercado laboral de pronto de acá, para asegurar en dónde tenemos suficiencia de talento, en dónde podemos exportar personal, pero sobre todo en dónde podemos buscar países aliados que puedan invertir en México para desarrollar el talento de mexicanos que quieran migrar para ahí. Pero otro de los grandes temas que creemos que es indispensable en este proceso de legitimar y regularizar los flujos de migración tiene que ver con el desarrollar mecanismos que transparenten los distintos canales de información de reclutamiento y de selección de personal que existen. Creo que hay miles de personas hoy en el mercado laboral que se han incorporado a facilitar estos procesos de vinculación laboral pero es fundamental que haya un observatorio de estas agencias de colocación privadas, que podamos nosotros identificar perfectamente quién trabaja en Alemania, quién está trabajando hoy en Bélgica, quién está trabajando hoy en Canadá, porque en México tengo una lista de agencias de colocación que yo puedo decir que son agencias que cumplen con los principios de contratación ética, pero no conozco quién está llegando a México a reclutar. Creo que nos hace falta trabajar mucho en este tema, entonces trabajar en los mecanismos de información y comunicación de país a país y sobre todo el desarrollar y concientizar mucho a las agencias de colocación de lo que implican los principios de reclutamiento ético de los que hablaba Estefan y los que creo que estamos todos involucrados en estos procesos. Porque normalmente dejamos que sea el ciudadano, que sea la persona la que investigue qué agencia o qué empresa puede estar impulsando reclutamientos correctos. Creo que habría que acercar mayor información a los ciudadanos y buscar la forma siempre de hacer corresponsables a las empresas. Por eso nos ha gustado mucho el modelo con Alemania.
I think that's a good note on which to thank you for your intervention and to come to Dr. Kate Tulenko. So Dr. Tulenko, we've heard the perspective of public employment services on the challenges and the opportunities for recruitment of migrant care workers. Cooperation between countries of origin and destination, we've just heard, can ensure workers and employers' needs are met, and that the negative impact of care workers or the negative impact on care workers' migration is minimized for both workers and communities of origin and destination. We heard about the triple win, example from Germany. In presenting your organization, Corvus Health, you indicate that you offer a sustainable recruitment solution for recruiting health workers from low and middle income countries. Can you tell us more about this model and why this model is good from a business perspective? And then could you tell us what can be done by the business community, but also by governments to create the necessary environment for such a business model to be upscaled? And you have 7 minutes for that. Thank you.
Well, thanks so much, Chidi, and it's a pleasure to be here. So first of all, it's important to know that there's almost no country in the world that's self-sufficient in training its own health and care workers. So that includes high-income countries. So whenever you recruit a health worker overseas, you're reducing the stock in that country. And as has been explained, most employers use private recruiters to recruit health and care workers. But unfortunately, that recruitment model is broken, it's flawed, and it's expensive. For example, the standard model when a recruiter gets a request is they put out some ads, they might use their network, maybe they'll have some events. So it can be very expensive regarding time and media purchasing. And it ends up being a low trust, high risk system because the care workers don't know who this is that's actually recruiting them and who it is that's employing them. And around the world, we see health and care workers, the terms of their contracts are not honored in terms of pay, work site, rural versus urban, workload, benefits, career advancement. Also, in worst cases, we see domestic care workers physically abused, we see them sexually assaulted, killed. Some workers have their passports taken away, they're virtually prisoners in their work site. And so this is that low trust, high risk model. And so we've built a high trust, low risk model. So we recruit health workers through their schools, through the nursing schools, through the medical schools, because the schools already have the contacts with all of their graduates and they don't need extra staff or media purchasing to do that. So it's much more affordable and it's trusted. And if any type of upgrade training is needed, we can use the facilities of that school. And with the money that's saved through this process, we are able to reinvest in the schools and train more nurses. So we're kind of like the Tom Shoes of recruiting. For every nurse you recruit, we can train 1 or 2 additional nurses, because really in many aspects, every nurse that's recruited represents a community that won't have a nurse, in the origin country. So that's why it's so important. And also from we look at it from a harm reduction point of view. Many of you are familiar with harm reduction in public health. For example, giving clean needles to drug users so they don't get HIV. Well, no one wants health workers to have to migrate. People want to stay home and have good jobs in their own country. But if people are going to migrate, we want them to be safe, and we want the communities they leave to be safe. And so that's why we've designed this model. And as we work with more and more schools, we get an economy of scale so that we can train more new nurses and care workers more cost effectively. And then from the point of view of what can governments and what can employers do, first of all, employers in high income countries can pay their staffs better. They can pay them with living wages, give them good benefits, including childcare, so that domestic workers will accept those positions. Plenty of unemployed people in most high income countries. And these are also especially the medically unserved. For example, in the US, young African Americans have an 8% unemployment rate, and that compares to the average unemployment rate of 3%. So it's almost 3 times as high. So the US needs to invest in training African Americans to be health workers and giving them these opportunities. But also, I think it's important for governments to set up third-party monitoring to make certificates so that they can certify recruiters. An important thing that Corvus Health is working on is we're in the early stages of creating a globally recognized senior care certificate. So you won't have to go through this process of recertification, that if perhaps a Kenyan has a certificate that she earned in Kenya, she can immediately go to Germany once she has her German skills. She does not need to be requalified because her certificate is already recognized. And we've seen the advantage of this recognition of qualifications in the EU. There's the Bologna Agreement, where all health worker degrees in the EU are recognized in all other countries. We're also starting to see regional regulation of health workers in East Africa. The EXA region is regulating nurses and physicians at the regional level. We know that some countries in Asia are moving towards that as well. I think it would make sense in Latin America, especially with PAHO's help, to do that. Because although nursing is different in every country, there are different standards of care, there are cultural differences, I think we all can agree on some foundational skills that all care workers need. And then you can do top-ups or country adjustments after that.
Thank you so much. Very interesting to hear the experience of Corvus Health and, what seems like quite an innovative approach, recruiting directly from the schools. And thank you also for reminding us that when we're talking about benefits that are indeed this triple win benefits, that we're talking about, keeping communities in countries of origin safe as well.
And just let me add 2 quick points that I forgot. One is that we do follow up with the care worker and call them periodically to make sure that they're safe, that their contract is being honored, that they want to stay there. And also governments need to do more to educate the care workers. What are your rights? Your worker cannot throw you out of the country, and to give them, a phone number and email to contact if they have a problem, because especially with domestic care workers, the employers take advantage of the workers' ignorance, and that's how they sort of hold them hostage. And so if we have a care worker who's aware of her rights, who knows how to demand her rights, we'll see less of the most extreme abuses.
Thank you for that. Again, reminding us about how important it is to pursue these education programs and ensure that workers are very much aware of their rights, something that I'm sure the trade unions are very much engaged in, in ensuring not only that they're aware of their rights, but that they can indeed defend those rights, collectively. So Genevieve Gentianos, I'm coming to you now. Trade unions in the public sector are clearly advocating for public investment towards sustainable human resources for health for all countries, something which we have heard repeated throughout, this session. Having heard from the previous speakers on challenges and opportunities on achieving fair recruitment for migrant workers, can you tell us what lessons can be drawn from the recent care crises and the impact on recruitment of migrant care workers, in particular for women? And then I'm also going to ask you to tell us what recommendations you would give to the institutions represented by your fellow speakers to ensure that migrant care workers are fairly recruited and that their rights are respected at destination. Over to you.
Thank you very much, Chidi, and thank you also to my co-panelists. And I've been listening with very great interest on the experiences and lessons that they've shared. As the Global Trade Union Federation representing care workers, around 10 million of them are in our membership in the medical, health, and social care sectors. We really have been following this issue, and we've just gotten through COVID with a lot of lessons learned. And the moderator has already explained how important it is for PSI that we are fighting both on the right to health of all populations of all countries, and that includes having a sustainable human resources for health. And rightly so, it was mentioned that no country in the world is able to sustainably produce its own human resources for health, but more so for the developing countries with fragile health systems. And this is very much a big concern for PSI. And at the same time, to ensure that healthcare workers' rights, a lot of them, migrant healthcare workers, particularly women who are really at the front lines of the COVID pandemic, have been experiencing unequal and disproportionate impacts of the COVID-19 pandemic. And this is already the COVID-19 has exacerbated and has really highlighted these shortages, these deficiencies that are already there. We were already short of healthcare workers before COVID struck, and COVID-19 just amplified these existing global shortages that both rich and poor countries were experiencing the pandemic, but poorer countries do not have enough. And yet, our concern as well was that before and during the pandemic, active recruitment have been happening with richer countries recruiting from countries that are having very, very big problems. So there were many measures put in place on that, mobility restrictions, and on both sides of these countries. Decent work deficits, that was very, very clear that though they are very essential during the crisis, yet their rights are not as essentially recognized. And that was a really big issue for us. We were on the streets, we were having demonstrations and strikes, really demanding not just the clapping, but really recognition and valuing of healthcare workers. And indeed, countries have put in place recognition. There were countries who have recognized COVID as an occupational health and safety, also raising salaries and benefits. But unfortunately, a lot of these are not fully implemented yet. So we are still pushing this in the collective agreements. And yes, it was mentioned in terms of health of benefits and even the right to healthcare. They were the ones caring for COVID patients, yet they don't even have healthcare and social protection. That was really, really unacceptable. The lack of income protection, employment security, and social protection, as already mentioned. And yes, I've mentioned all of these lessons that we've seen, and we've documented this. Trade unions at the front lines, defending workers, all health workers, including migrant healthcare workers, a majority women. And so we are still very much in that fight as we are learning lessons from the pandemic and preparing for the next ones. So we are working with the WHO, the ILO, to make sure that we learn from these lessons. And one concern as well that we saw was the repayment clauses, that even though there is a claim that recruitment and placement agencies do not impose recruitment fees, however, clauses for repayment when the health worker is not able to complete his or her contract. She or he has to pay thousands of pounds, for example, and that really locks them into the job, and that also really makes them vulnerable to accept whatever conditions to be thrown at the front lines because they don't have a choice. So we should not just look at the cost of recruitment, but also look at all the conditions and review the contracts. And this is where the trade unions are really out there representing and assisting health workers. So I guess, yes, do I have the second question yet for the recommendations? I've said so much and I can only summarize a few.
Absolutely. I was just going to say to you, are there some specific recommendations for our fellow panelists that you would like to highlight in your intervention?
We have so many recommendations, and in fact, we've shared the results of our study. We did a survey among our affiliates in 42 countries on what our experiences are, what were our challenges, and what we have learned. And basically, with this collaborative project with Open University, we've documented this evidence, and as what we have concluded, that the COVID-19, the care crisis have really shown the disproportionate and unequal risks faced by migrant healthcare workers. And we would summarize our three main recommendations as follows: that in order for us to have rights-based, socially just, and socially sustainable governance of healthcare worker migration, which I believe all the panelists share these goals, including the ILO, of course, that there are three key elements for PSI that's important. One is fair and ethical recruitment. Laws must ensure health workers are treated fairly and as equals, and that migration does not create shortages of healthcare workers in poorer countries. That models and schemes that we are implementing to resolve or to provide solutions to health workers shortages in both rich countries and poor countries do not only benefit the richer countries, but actually looks at the human resources for health and public healthcare services in developing countries. So these schemes are not just recruitment tools, but actually looks at development, sustainable development for all countries, and protection and recognition of the rights of healthcare workers. Second, strengthening the rights of health workers. Workers' rights must be guaranteed by governments and employers. The WHO Code of Practice, the International Human Rights Norms, and the ILO conventions on migrant workers are very important and fundamental to this rights-based and sustainable migration policy in the health sector. And thirdly, social dialogue. And this is where we are really praising models such as what we've experienced and are working with Germany on this, that workers, employers, governments, even with private recruitment agencies, and we're doing it now. Even as Germany recruits in the private, with private recruiters, we are also there. The trade unions are there offering advice, assisting our workers on both origin and destination countries. So this is very, very important. And only through these transparent and democratic recruitment systems can we really ensure that we have rights-based policies. Thank you.
Thank you very much, Genevieve. And I heard you really emphasize, in that the approach, and I think others, other panelists have also emphasized this, that the approach really has to be about protecting rights of the care workers themselves, and rights of people in both origin and destination countries to health and well-being. And I wonder I have a question for the panelists before we close out. How do we go about the monitoring to ensure the sort of minimum harm or do no harm that Dr. Tulenko spoke about, for example, in recruitment of care workers, given that we are still so far short of having optimum numbers in the global health and care workforces? We know that this is a goal and an aim, but how do we in practice go about ensuring that ethical recruitment, that triple win situation that we hear, actually plays out in practice? And that I'm throwing that open to any panelist who would like to.
I'll have a whack at that. We definitely need to monitor the flows. Usually with regulated groups, we know if they're leaving. For example, if a registered nurse leaves Kenya, she has to approach the nursing council to have her her license verified. So they actually have the data on the nurses that are leaving. So we need to be able to gather that data and analyze it. We also, of course, need the monitoring on the receiving side. And we need to educate our domestic nurses to make sure that they report abuses of international nurses as well. But I do think that it's important that governments understand that the need to train more workers. And what we're basically seeing is an educational arbitrage. Health workers are the most expensive workers to train, more than education workers or engineers or any other type of worker in any other type of field. It costs $1 million to educate a physician in the US. It costs about $200,000 or to in some countries, $50,000 in Africa. And so governments are just not investing in their own people to educate them.
Thanks very much. And I saw that, Stephen, you had your hand up, so please go ahead.
Yes, if I might add a few insights from my part. First of all, I think the most important lesson we have learned from the last years of experience of recruiting nurses abroad and also for trying to implement a better regime of oversight for private recruiters and also of oversight about the working conditions of healthcare workers, be them migrant workers or domestic workers. I think what we've learned is that the most important deficit we have to address in Germany, but all over the world, is really to collect enough data regarding the working conditions and thus analyzing these data to ensure that, for example, a migrant care worker in the first workplace she finds in Germany meets working conditions which transparently represent average working conditions in Germany, because the logic with attracting migrant care workers, and this is what we find out in Germany as well, is that we have a sort of different groups of care workers, and one, the least well paid, the least well trained, the least well monitored group is in danger of just slipping away and just not finding a foothold to really earn decent money and find decent working conditions. So why is this? Because in healthcare in general and in Germany as well, although we have very dedicated and very specific measures of working conditions all over the place, due to lack of representation on the one hand, and due to the lack of oversight on the other hand, we don't have any sustainable and reliable data on the real demand for healthcare workers. And there's also a bit of intransparency, as I pointed out in my statement, regarding the payment of healthcare workers, which leads to quite astonishing results. For example, healthcare workers in Germany tend to prefer working for a job leasing company to working in a care home, because the working conditions are more transparent and more comparable to each other. In all other work places, this is the other way around. So you can see transparency based on data is the most important point we have to address to ensure equal pay and equal conditions all over the market for healthcare workers. Thank you.
I want to make one final comment on the ethics. One of the most important tools low-income governments have to train and retain workers is bonding. This is when a worker signs a legal contract. If you pay for my nursing degree, I will work for you for 5 years. So I certainly hope that if a nurse applies for a license in Germany, but the Mexican government says we have bonded her for 5 years, that the German Nursing Council would not license her. They would wait until her 5 years were over. We must, respect the bonding that's done by governments and private employers, because this person has signed a legal contract, and there always are exits as well, that you either work the 5 years, you pay a certain amount of money, but we really need to honor those contracts.
Thank you. I'm going straight now to Donaciano, because I saw you had your hand up. Thank you. No, I saw that you had your hand raised and wondered whether you wanted to come in with some reflections. And then,
Sí.
yes, I was saying after that, I'll hand over straight
Sí, muchas
directly to
gracias.
Jen.
Creo que definitivamente la necesidad de mejorar los canales de reclutamiento y selección de personal de las áreas de salud pasa por el fortalecer estos mecanismos de información para que las personas interesadas sepan en dónde están oportunidades. De pronto, la oportunidad que le llega a una persona del área de la salud es solo aquella que tiende a hacerse muy visible, como lo dijo Kate, de pronto porque hay una gran inversión en redes sociales y se ve y hay una vacante visible. Pero no significa que sea la mejor oportunidad para la persona que desea trabajar en un hospital o en un área determinada. Entonces, creo que habrá que fortalecer estos canales de información con los países de origen para que se abra el abanico de oportunidades que tenemos. En México, necesariamente, tenemos que fortalecer los mecanismos de regulación y control de agencias privadas que operan en México y de aquellos que vienen a reclutar a nuestro país. En eso, el tema de fortalecer los acuerdos binacionales, países de origen y destino, es fundamental para garantizar el acompañamiento del personal de la salud. Creo que en estos acuerdos definitivamente hay procesos que se han establecido de origen, pero que hay que irlos actualizando conforme va surgiendo los problemas para mejorar los canales de reclutamiento, ¿no? Ese sería mi comentario. Muchas gracias.
Thank you very much. And to save time, I'll jump in now. To ensure monitoring, I completely agree with transparency and data and monitoring. And in our experience in the Germany-Philippines bilateral labor agreement on nurses, our involvement as trade unions in a social dialogue, it was very, very important in terms of documenting representation and really also looking at labor market analysis and even reviewing the model contracts, which was very, very important. And I would hope now that Mexico is also here and Germany is here, that we would also be able to replicate this model in Mexico. PSI has members in Mexico, and of course, PSI has Verdi in Germany, who is very much very supportive of the whole triple win projects. And yes, there is also, we've worked so hard on this, the UN guidance on bilateral labor agreements, which was headed by the ILO along with IOM, has laid out all these best practices as well as the elements in terms of protection of rights, as well as the right to health, as we have emphasized during the case studies that we contributed to this. And the WHO is coming up with its own guidance on bilateral agreements on health worker migration and mobility. And this is where we as stakeholders, we as trade unions are putting in our examples and experiences on what works. And again, government to government involvement and regulation is very, very important, both in public recruitment and in private recruitment. Thank you.
Thank you very much, Jen. And I, pick up on what you say about the role of social dialogue and trade unions, which I assume are also a source of data collection and in terms of the monitoring of working conditions, of pay, of all the obligations that may arise under the agreements and the contracts in that. I think we are coming to the end of the session, unless any of our speakers have a last minute intervention they would like to make or to reinforce anything that they have said previously. But seeing no immediate hands being raised, I think I would really like to just thank all of you for your insights and contributions today. And I think very often we are more equipped, I would say, not even only inclined, but equipped to look at the challenges and the difficulties and the problems concerning such a difficult area, because it's a complex area with many ethical issues also involved. And I think our panelists today have really pointed to some of the solutions in spite of those complexities. There are ways of ensuring that recruitment of a very, undervalued but crucial workforce is fair, particularly when it comes to cooperation between countries and recruitment across borders. That is one of the trickiest areas where we see very huge, very often abuses, decent work deficits, and yet there are practical solutions that can be crafted where there is a will. We've heard from ethical recruiters, we've heard from government recruiters, we've heard from trade unions, and I think bringing all those together is essential indeed to really address some of these huge problems. In closing, I'll just say a little bit about myself because I did not introduce myself at the beginning. So my name is Chidi King. I'm the Chief of Branch of the Gender Equality, Diversity, Inclusion at the ILO. Our branch, JEDI, if you like, is part of the Work Quality Department, which also hosts the Migrant branch and the Inward branch. Hence the pleasure of being involved in this session today. I would really like to thank all of our speakers enormously, again, for all of your insights, for your contributions. And I hope that some of the practices that you have shown us today will be picked up and replicated, elsewhere and at scale. I also really want to thank my interpreter for today, Ricardo, and of course to our partners at the global, I might get this all wrong, the Global Forum for Recruitment in bringing us together under this webinar. And then last but certainly not least, I also want to thank my colleagues here at the ILO who have worked to make our participation in this webinar so smooth and easy. So thank you very much again to our presenters, Stephen Hoyker, Donaciano Espinosa, Genevieve Genciano, and Dr. Kate Telenko, and to everyone else involved. Thank you very much.